maybe 20, 25 minutes or so, depending on questions. If you have questions during the presentation, there is the Q&A function that I've just dragged over to the screen. If you could answer or enter your questions, I'm sorry, through that feature. We will go ahead and answer them probably as we go, but we'll make sure we answer all questions. Certainly at the end, there'll be plenty of time. We are recording the webinar as well, so Amanda and our team will have a copy of the webinar to distribute later today as well. But again, my name is Kevin Kennedy. I'm with SALA. We are the sponsors of the program being brought to you through ACRA. SALA, just as some background, we are a trade association for, as you can see there, small associations. So our members are groups like ACRA and others. There are about 18,500 or so of similar size in the country. So it's quite a large group, if you will. But today we're talking about the SALA Healthcare Program. The program itself is really an effort to simplify really our increasingly complex healthcare that we have here. There's a great choice of affordable healthcare solutions for folks to choose from. A couple of stats there on the screen. You'll see less than half of the small businesses in the U.S. actually offer healthcare now. In fact, as of 2017, I believe it was 43 or 44%. I'm not sure what it is recently. I apologize, I've not looked. On average, folks who enroll in the program are able to save right around 60% compared to what you would pay for an insurance plan on the state exchanges. That number can vary a bit depending on where you live. I live in Maryland, just right outside DC, for example, and my savings is right around 55%. We have folks in more rural areas of Colorado and Alaska and elsewhere that are saving 75 and 80%. So really depending on where you live and how much you are paying or how much the insurance would cost you on the state exchange, will of course determine how much your savings might be. That last bullet there, we run a survey every summer. We'll be doing another survey this summer, and last summer, 91% of participants in the program said that they were either very or extremely satisfied with the program. But what we are talking about today is an alternative approach to traditional health insurance. So the options and components that we're talking about today are not traditional health insurance products. We have two main partners in the program. The first is Apex Management, and the second is Sedera. The Apex plans focus on preventive care. And the Sedera options there, that's medical cost sharing. And I'll actually spend most of my time today talking about Sedera. As medical cost sharing might be a new concept for many of you. It certainly was for us when we first started talking with them a few years ago. But we'll make sure to get all your questions answered. A quick look at the program, really our healthcare in general. There's three components, if you will. There are large costs, which we refer to as needs. That's the significant medical events we all go through at different times in our life. It could be surgery due to an accident, or hospitalization, or maybe just some diagnostic imaging we're going through. Then there are small to medium costs. That's more run-of-the-mill type stuff, a cold, a sinus infection, the flu, et cetera. And then there's preventative care. And that's everything from childhood immunizations to colonoscopies and mammograms and your annual physical and really everything in between. The program covers all three of these, and I'll address each one of these areas individually as I go through. But I'm going to start off by talking about Sedera. As I mentioned, Sedera is medical cost sharing. And for those of you not familiar with medical cost sharing, it originated back in the 1980s. And it's really had a foothold with religious organizations. Different churches and congregations over time have gotten together and formed a cost sharing entity through which their members and parishioners could share in each other's expenses. Sedera is not a religious organization. They don't have any religious affiliation. Their parent company is actually called the CARES Group. The CARES Group is a medical bill negotiating company, and they're the company that many of the religious organizations have used since the late 80s, early 90s to negotiate their larger bills. Well, when all of our healthcare costs really just started to increase at an unsustainable rate, the CARES Group formed Sedera. Sedera is built upon the same best practices and principles as the religious organizations, but again, there is not a religious component to Sedera at all. So how did we get here? Well, how did Sedera get here, and why are we all on this call? We've referred to this as the unsustainable squeeze. As you can see on that graph on the right, over that 10-year period represented there, insurance premiums have increased by about 55%, and the portion that the employees are responsible has increased right around 70%. But our wages, of course, have increased at a lower rate of around 19%. So the unsustainable squeeze is simply that something has to give here in terms of how our healthcare is handled. There are many options out there for folks to have in terms of their healthcare, and what we're talking about today is an option for many of folks to consider. So when it comes to Sedera, their objectives are really all of our objectives. It's enjoying the freedom to choose how we get our healthcare and from whom we get our healthcare from, lowering our monthly expenses, of course, and reducing our large medical costs. When I go through the details of medical cost sharing in just a few slides, you'll see that for almost everyone, it will certainly lower your monthly contributions or your monthly expenses. But then for most of us, depending on the IUA, which is a term to get familiar with, but depending on the IUA you choose, it will also lower your out-of-pocket costs as well. And I'll get into all those details shortly. But what makes medical cost sharing unique? First of all, every member is a cash pay patient. So again, this is not insurance, it's not a transfer of risk, but every member is a cash pay patient. But what that allows us to do is actually here underneath of it, it offers freedom from networks. So when you use your Sedera membership, you can go to any hospital you like or any doctor you like to get the care that you need. You do not have to operate within the network. On the Apex component, that preventive care component I briefly mentioned a minute ago, they do have a network that they use, and I'll go through those details towards the end of the program here. But for Sedera and for medical cost sharing, it's freedom from networks. I'll go through how the cash pay patient works in a few slides as well, but sharing is on a per need basis, which is important to remember. So as opposed to having to deal with an annual deductible that you must meet, sharing is on a per need basis, and I'll talk about shortly on how that works. One last illustration here. This is how medical cost sharing has really grown in recent years. And you'll see the uptick really started in 2011, 2012, when all of our healthcare costs really started to increase at just an unsustainable rate. Folks started looking for an alternative. And what we're talking about here today is one of the alternatives for folks to consider. But as of the end of 2017, there's more than $1 billion being shared annually between about 1 million members. We're told that membership number now is closer to 1.4 or 1.5 million, so it continues to grow in a pretty dramatic way. What is a need? Let's talk about how medical cost sharing works within Sedera. And again, these medical events, we refer to as a need, but a need is one or more medical expense caused by a single accident or illness. So in other words, the question we get often asked is, if I'm in a car accident or similar scenario, and I had a broken arm and a broken leg, for example, is that one need or is that two? Well, that's just one need because it's one or more medical expenses caused by a single accident or illness. Now, the member's responsibility is the IUA, the initial insurable amount. That's what you're going to be financially responsible for when you have to use your Sedera membership. You determine that when you enroll, and as you can see, there are five IUAs to choose from. It's $500, $1,000, $1,500, $2,500, or $5,000. And again, that's what you're going to be financially responsible for. So if you look at the illustration there on the left, this is someone who broke their leg. So there'd be costs for the ride in the ambulance, the stay at the hospital, surgery, diagnostic imaging, prescriptions and pain medicine and physical therapy. All of these costs, whether they occur over a period of weeks or over a period of years, but all of these costs are wrapped up into one need. And the member's responsibility is that IUA that they chose. So just to make the math easy, let's say that the broken leg, all the expenses were $10,000, and you had selected the $1,000 IUA, your responsibility would be that $1,000. The balance, the $9,000, would be shared through Sedera and paid accordingly. Now I'll go through how the mechanics and how that works in 2 slides. Down here at the bottom, you'll see if you enroll as an individual, you're responsible for the first 3 needs in the calendar year. If you enroll as a family, you're responsible for the first 5. If you had a 4th as an individual or 6 or more as a family, it would be at a $0 IUA. So if you're looking at this and trying to determine what your max out-of-pocket liability might be, if you would enroll as an individual, it would be 3 times the IUA you chose. Or if you enroll as a family, it'd be 5 times the IUA you chose. Now, as a practical matter, we all have far fewer than that in the calendar year, but it is good to know that there is a cap in terms of what your financial exposure might be. Myself, for example, I've been on the $1,500 IUA since 2018. Fortunately, I've actually not had to use my Sedera membership, but it is important for me to know at least that the maximum exposure I would have financially would be $4,500, and that's if I had 3 such events in the calendar year. I'll talk about this more in a few slides. Here's a real life example. This actually comes from the CEO of Sedera. Prior to joining Sedera, he and his family with a young child had a persistent ear infection. They had traditional insurance with a $5,000 deductible. As you can see on the bottom there, after a series of antibiotics and boosters, they went to an ENT who inserted tubes into the child's ears. On the left, with traditional insurance, their out-of-pocket costs are around $2,500 with copays and then the cost of the surgery. And on the right, of course, if they had selected the $500 IUA, their out-of-pocket cost would just be $500. So the sharing really works in really two different ways. One is, let's go with the broken leg scenario. You break your leg, you go to the hospital, you get the care that you need. After that, you would call SALA, tell them what happened, I broke my leg, and you would open a needs claim for sharing. Your responsibility would be to take all the invoices from the hospital and from the doctor's office or whatever else you might have received and upload them to SALA. They have a great app online. You're assigned a needs processor throughout the case, and generally those invoices are paid in about 3 to 4 weeks. The way the sharing works, since there's not a transfer of risk, is that money would be sent to you. So if we look at this scenario here with $2,500 and the $500 IUA, let's say there was $2,000 that was still owed, they would send you a check for $2,000 and you would pay the balance of your bills. That's the essence of how cost sharing works. Now that's on an emergency basis. Let's say you were having a scheduled surgery. Say you tore your rotator cuff and you're having surgery in 2 weeks. You would call SALA, let them know, I tore my rotator cuff, I'm having surgery in a couple of weeks. In that scenario, SALA may actually reach out to the facility and reach out to the doctor and try to prepay for your surgery. They will prepay if to be honest, them and their parent company, the CARES Group, if they're able to negotiate a better deal by prepaying and paying in cash. It was rather eye-opening to us when we were doing our own due diligence on the product a few years ago. We reached out to a couple of hospitals and spoke to them and doing our own vetting of the program here, and asked them what happens if someone prepays for surgery, as SALA does, and pays in cash. We spoke to 2 or 3 hospitals on this, and they all said that they discount 50% or more right off the top and right off the bat. So it's important to know that through negotiation and through prepaying or through their affiliation with their parent company, the CARES Group, SALA saves on average between 47 and 53% by managing the bills in such a way. But in general, that's the way the sharing works. Either it's after the fact and you upload your bills, or it's before the procedure itself and they will look to prepay. Now, there are some nuances to the program. These next 3 slides are actually key in determining if the program would work for you. I should have said this at the onset, but in general, the program itself is a good option for probably 80% of us to consider in getting our health care. But it's not the right option for everyone. When I get to the pre-existing conditions slide, we'll talk about that a bit more. But first, when folks do enroll, they do have to commit to a few things. One is to strive to live a healthy and balanced lifestyle. Obviously, making smart choices like diet and exercise can improve one's quality of life, but it also keeps us all out of the hospital and all out of the doctor's office. Striving to live a healthy and balanced lifestyle is obviously not legally binding, but is something that members have to commit to try to do. You also have to commit to not use illegal narcotics and to not operate a vehicle while intoxicated. So what does that mean? It means if you're driving while intoxicated and you get into an accident and you're injured and you have medical bills, those bills cannot be shared through the community. The principle there is that the community should not have to pay for someone's illegal activity. Also, the last bullet here, tobacco users are certainly welcome to join, everyone is, but there is a $75 surcharge per month per household. So in other words, if you have a husband and wife who both smoke and are members, it's one $75 charge per month, not 2. Lastly, the fine print there on the bottom, tobacco users over the age of 50 have a $25,000 per need sharing limit for the top 4 diseases associated with tobacco usage, which is heart disease, stroke, COPD, and cancer. Medications. There are basically 2 types of medicines we all take. There are those that are curative and those that are maintenance. Curative medicines, as you see listed there, could be antibiotics or pain meds or chemotherapy drugs, but these are drugs we take for a period of time until we are cured. There's an end date at which point we stop taking those medicines. The costs for curative medicines are wrapped up into that IUA math, if you will, and shared through SALA, through the scenarios we just discussed. The other type of medicines many of us take are maintenance type medicines. It could be for high blood pressure or high cholesterol. An overactive thyroid is a pretty common one. I take them for rheumatoid arthritis. But these are drugs we take daily or monthly or weekly or however they are prescribed, and we'll do so for the foreseeable future. There are several options to get these medicines paid for. There's GoodRx, which is a third party. Many of you have probably seen them advertised on TV. Now, I will tell you, GoodRx has great discounts for medicines that are very common for like high blood pressure, high cholesterol, oftentimes less than $10 per month. There's also Liberty Benefits, which is an add-on To be honest, we don't have too many people signed up for Liberty benefits. It's an extra $27.50 per month, but they have great discounts on drugs that are more expensive, for lack of a better way to explain it. The third option is actually not listed here, but I'll talk about it towards the end of the slide deck, and that's the prescription drug program through the Apex Advantage plan. That's actually, I get my medicine filled for my rheumatoid arthritis. I would say that's how the majority of our folks get their medicines filled. So I'll talk about that a bit more. This slide on pre-existing conditions, I think is the most important slide in determining if this program will work for you. It certainly was for me. I do have a pre-existing condition, like I just mentioned, with my rheumatoid arthritis. So let me explain to you how the restrictions work. First of all, a pre-existing condition is defined as anything you've had a symptom of or received treatment for in the prior 36 months to joining. So when I enrolled, I disclosed I had rheumatoid arthritis. Now, the restrictions only for the SEDERA component. So in the Apex component, which I will talk about shortly, that's for my preventive care, but that also covers my visits to my rheumatologist. So through the Apex side of the program, I pay a copay when I see my rheumatologist. I pay a small amount for my prescriptions every month, and I pay $50 copay for my blood work. So that is all covered in terms of my ongoing care that I need for my condition. What this is addressing is if I were to have a need, if I were to have a medical event as a result of my pre-existing condition, that's when these restrictions would come into play. So using myself as an example, let's say I needed surgery. If I needed that surgery in the first year of joining, I would be 100% responsible for paying the cost of that surgery. None of it would be shareable. If it happened in year 2, up to $15,000 would be shared. The balance would be my responsibility. In year 3, up to $30,000 would be shared. After that, it's fully shareable. So for me, with my condition, it's a chronic condition. I've had it forever. I'll have it for forever. So there's nothing prohibiting me from joining in terms of an upcoming, perhaps, medical event. There's nothing on the horizon with my rheumatoid arthritis. But let's say I had an active cancer, or say my wife was pregnant when we went to enroll. That would obviously not be the right time for me to enroll, because it would create a pretty significant financial burden for me and my family in that first year, and perhaps into the second year. So for folks with pre-existing conditions, I'm sure most of us certainly know the status of our condition. But if you would like more details or would like to talk with us one-on-one and get a real good understanding, our contact information will be at the end of the slide deck. We can also send you additional details. We can communicate through email or have a phone call. But the point here is the last thing we want anyone to do is to enroll in the program, not understanding how these restrictions work or how medical cost sharing works, and all of a sudden be stuck with a large bill. So please take the time. We are here to answer all your questions. And again, I'm not asking anyone to talk about their pre-existing conditions publicly. So just reach out to us and we can talk with you on it one-on-one. Now, included with everyone's membership is a subscription to Teladoc. Teladoc and telemedicine has been the news lately with COVID. But Teladoc is actually the largest provider of telemedicine in the US. And telemedicine itself has really caught on recently over the last couple of years. In fact, more than 75% of Fortune 500 companies offer telemedicine as of, I think, the middle of 2019 or so, and I'm sure that has increased since then. And telemedicine is, if you've not used it, it's exactly what it sounds like. You connect with a doctor virtually over the phone or through your computer. It's 24/7, 365 days a year. And the great part is, if you need to talk to a doctor at 2 o'clock in the morning, you can talk to a doctor at 2 o'clock in the morning, and there's no charging doing so. You do not have a copay or any additional cost by using the service. It's built into your monthly fee. Teladoc is great for small issues too. Let's say you're sick and you need a Z-Pack, or we had a woman not that long ago who had an eye infection and she did a video call with the doctor. But the doctors can prescribe medicine and send that prescription to your local pharmacy and you pick it up. So it's a money saver because there's no additional money coming out of your pocket to use the service. And it's also a time saver. You can reach out to Teladoc anytime from your house, from your car, from your office, from wherever you might be. Last year, it was roughly 45% of our folks in the program did actually use Teladoc and use telemedicine, and I'm sure will continue to increase. It's a great service. Also included is 2nd.MD that you see listed there. 2nd.MD is a great way to get a second opinion on anything you're going through medically speaking, of course, and some of the nation's top doctors that practice at places like the Mayo Clinic and Johns Hopkins and elsewhere. 2nd.MD is there for 2 reasons. One is there was a study that showed that the average physician was 13 years behind on his or her continuing education. So 2nd.MD makes sure we all have access to the most up-to-date information. And again, there's no cost in using 2nd.MD. The second reason is that if you're having an elective surgery, Sedera requires you to get a second opinion, and you're going to do that through 2nd.MD. It's not a heavy lift. It's done virtually. It's generally done in an email or two. And also that opinion that comes from 2nd.MD is not binding. You and your doctor make the decision on what's best for you for your healthcare. But again, Sedera wants to make sure we all have access to the most up-to-date information that's out there. 2nd.MD, by the way, in that survey I mentioned earlier, it also got great reviews. People generally love the service. But that's it for the large costs, the needs that we discussed, and medical cost sharing. Again, Sedera's focus is really on the significant medical events, surgery due to an accident or hospitalization or some significant diagnostic imaging we're all going through. It also includes teledoc and 2nd.MD, like I mentioned. But I'm going to switch and talk about the APEX plans. The APEX plans offer 2 plans to choose from. The focus is really on preventive care. There's the basic plan and the advantage plan. The advantage plan offers some ongoing care needs that would address the small to medium costs, but the basic plan is the first option to choose from. As you see, it offers 100% coverage for all your preventive care needs. These are the needs that the Affordable Care Act defined. If you recall, when the IRS was issuing penalties to folks for not having adequate health care, it was focused on preventive care. So even though the penalties have gone away, certain states have implemented them now as well, and other states are considering the penalties. So it's good to know that it meets the requirements. What's important to know in the basic plan is that it covers your preventive care 100%, but does not cover anything else. So if you wanted to go to the doctor because you had the flu and you didn't want to use teledoc, and you wanted to physically see your doctor, you would have to pay for that office visit. There is no coverage for the basic plan for anything outside of preventive care. But it does meet the government's requirements to set up a health savings account. And HSA, as you may or may not know, is a great way to put away tax-free dollars to be used down the road for any qualified medical expense, such as dental or vision, doctor visits, and also to pay your Sedera IUA. Probably 30%, maybe a bit more, of folks who enroll select the basic plan. They're folks who are generally in pretty good health, not necessarily on any prescriptions, because again, the basic plan does not have prescription drug coverage, but there are folks that are in generally pretty good health, only go to the doctor for preventive care, but it allows them to get all their preventive care covered and also set up an HSA to put away some tax-free dollars to be used down the road if and when they need them. As you see there, for an individual, it's $3,550 in 2020 that you can put away tax-free. And for families, it's $7,100. And of course, those over 55 can put away an additional $1,000. I'll be honest with all of you. If I did not have rheumatoid arthritis, I would probably be on the basic plan. I would take advantage of the health savings account and save myself some money. Also, we've had folks that are on a prescription, like I mentioned, for high blood pressure or high cholesterol or something like that. And through a third party like GoodRx, financially, it still makes more sense for them to go on the basic plan, take advantage of the HSA, and use a third party for their prescription. So depending on your needs, the basic plan may or may not be a good option for you. The second option, which is where most of us are on, including myself, is the Advantage plan. Again, as you see there, the Advantage plan covers all your preventive care 100%. It then has a co-payment structure for any ongoing care, like I mentioned earlier. So if I go to my primary care doctor, it's a $20 copay. When I go to my rheumatologist, it's a $50 copay. My blood work's $50. And then this program also has a prescription drug program. If you recall back to that slide on Sedera, when I talked about curative medicine and preventive medicine, or maintenance medicine, sorry. Maintenance medicine generally is in tiers 1, 2, and 3 that you see here. Generics are tiers 1 and 2, and preferred brand name tiers 3. The higher tiers, 4, 5, and 6, are generally medicines that are more curative in nature. What's important to note here, if you are in a medicine, we can, one, make sure it's covered in the formulary. Drug formularies do change often, believe it or not, but we can make sure it's covered in the formulary and also tell you how much it costs. My medicine, for example, is a tier 3 preferred brand name, and it's $27 per month, which is right around where it's always been for me. So this is how I get my medicine filled. This was the third option that I mentioned earlier that many folks do take advantage of. Now, when I talked about Sedera and medical cost sharing, I made sure to note that they did not use a network. It's network independent. On Apex, they use the multi-plan network. The multi-plan network is the largest network in the US. It's used by thousands of health plans like this one. There are more than 900,000 participating doctors in the plan and tens of thousands of facilities. So it's absolutely the best network we could have been a part of. This is just an example of a zip code south of DC here in Maryland. You'll see for primary care, there are 475 doctors that are in the network and local to that zip code. I will tell you, if you're in a populated area, you will find that there are thousands of doctors. We can certainly send you instructions to query the database or query the multi-plan network and see what doctors are in network and make sure your doctor's in network. I did the same when I enrolled. I made sure my primary care doctor was in there and my rheumatologist. For folks that are in more rural areas, there are fewer doctors in network, but simply because there are fewer doctors in that area. But like I said, multi-plan is the largest network in the US, and it's used by thousands of plans like this one. But let's talk pricing. As you can see on this slide, this is for the Apex plans. On the left, you see it's member only, or if you enroll as member and spouse, or member and just the children, or member and the entire family, meaning spouse and children. The second column here is for that basic plan I mentioned earlier that covers all your preventive care needs, but that's it. It does not offer any ongoing care. It does not offer prescription drug coverage, but it does allow you to set up a health savings account. This third column here is the Advantage plan. That's the plan I'm on. In fact, that's what that red arrow designates there. And again, the Advantage plan offers prescription drug coverage and copays for any ongoing care if that's what you and your family need. Once you pick the Apex plan that best fits you and your family, you would pair that with the SALA membership that best fits you and your family. For space reasons, I only have 2 of the IUAs listed here, but the IUAs, just to recall them, are $500, $1,000, $1,500, $2,500, or $5,000. On the left here, MO is member only, MS is member and spouse, MC is member and children, or MF is member and the entire family. Across the top, it's banded by age for those in their 20s, 30s, 40s, 50s, and 60s. And again, you see the red arrow, that's actually just the plan I'm on. What's important to note here is that the higher the IUA, meaning the more you're willing to pay out of pocket, the lower your monthly contribution would be. So if I'd selected the $1,000 IUA, for example, I'd be paying $191 per month. On the $1,500 IUA, I'm about $15 per month less on that plan. The $500 IUA is more, of course, and the $2,500 and $5,000 IUAs are less. On the ACRA website are all the details and all the costs are listed out there in the full grid of all the pricing. So for comparison, and just as an example, this is what I paid per month, $320. This will be the same for anyone who's in their 40s and makes the selections I did, which is the Advantage plan and the SALA $1,500 IUA. As a reminder, instead of having to deal with a $7,000 deductible that I used to have, I now have a $1,500 IUA on a per need basis. So for me, it saves me, like I said earlier, about 55% on the front end. It also saves me more money if and when I have to use my SALA membership on the back end, because I don't have a $7,000 deductible to deal with. I have a $1,500 IUA that I'm responsible for on a per need basis. On the website, you'll find all the details on the programs, also a recording similar to this one, and some other information on how to enroll and some enrollment videos as well. But there's also all the current rate sheets, details on SALA and the Apex plans, as well as telemedicine and 2nd.MD. I would like to note that on the Apex and SALA memberships, they have not had an increase in a couple of years. In fact, SALA has only had one price decrease since 2012. Lastly, on the Apex plans, I apologize, I neglected to mention this. Let me jump back here. There's a 4-year rate lock on these plans, only on Apex, but over the course of the first 4 years, the amount you pay cannot increase more than 9% in total across 4 years. So it's some rate stability in a rather unstable market. A quick summary of the offering. It's currently available in 45 states. It's temporarily unavailable in Vermont, Alaska, Washington, New York, and Illinois. It's our understanding Alaska and Washington should be available in the next, well, you know what, I'm not going to give you a time frame. I think COVID has delayed quite a bit. But at the beginning of the year, or maybe in February, they were hoping to be about 90 days. New York and Illinois and Vermont will follow. But again, COVID has certainly delayed quite a bit. But the program itself does not need an employer sponsor, so individual employees can join, full-time, part-time, seasonal, hourly, or salaried staff. The cost can be paid by the employee or the employer. So if you're an employer and you want to offer this to the employees and then offset the cost with a payroll deduction or whatever you choose, you certainly can. If you are an employer and you're not able to or simply don't want to offer this to the employees, but you are a member, of course, of the association, your employees can sign up and enroll and be responsible for the costs themselves. The one caveat here on all of this, of course, is you do have to be a member of ACRA. Of course, as I mentioned earlier, the average savings is right around 60%. It does vary quite a bit depending on where you live. Lastly, there is a dental option that's been added. Those details are also on the website. It sets up just like any other dental plan you've ever had, where it covers your preventive care and has a cap on what else it covers in terms of other procedures that you may or may not need. Here's our contact information. Again, if you'd like to talk about the plan in more details, if you'd like more information, just let us know. We can get on the phone with you or do it through email, especially if you have questions on any pre-existing conditions or similar matters. Reach out to us anytime. Email's best, hpsupport@small-associations.org. If not, you can certainly call that 888-994-4979. That will put you into the queue, and we will certainly return your call. But either way, feel free to reach out to us at any time. I don't see any questions still, so that's the end of the presentation here. I'll give it another couple minutes here and make sure nobody has any questions. Now, I'll leave the contact information up here. Again, reach out to us anytime. Happy to speak with you. We certainly hope everyone is doing well. We hope your families and friends are doing well too, with everything that's going on out there. We are getting close to opening up out here in Maryland. At least much of Maryland has opened up. My county is actually borders Washington D.C., and we have not started to open up yet. I think we are going to start here soon, I hope. Okay, we have some questions here. Do all employees have to join at the same time, or can membership be staggered? It can be staggered, Lindsay. Some employees can join, one employee can join, 10 employees can join, whatever it is, and they can join over whatever period it makes sense to them or the company. Also, you can offer this alongside a traditional insurance product as well. You can offer both. You can certainly do that. So it's really quite flexible. Trish, how does this integrate with open enrollment period? Trish, that's a great question because I completely skipped that. We have rolling enrollment. So people can enroll at any time during the year, and they can leave at any time during the year. So you can enroll this month, you can enroll in June, July, August, or you can enroll at the end of the year. It's truly up to you. The one date to keep in mind is the 18th. The 18th is our cutoff every month. So if you enroll by the 18th of, well, now we just passed. If you enroll by the 18th of June, your coverage would start July 1st. If you enroll between June 19th and July 18th, it would be August 1st. So the 18th is the date to keep in mind. But again, we have rolling enrollment. You can enroll anytime during the year. Also, for any seasonal workers, there's no long-term commitment. We have a number of folks that have seasonal workers, and they enroll during the season. If the company is paying for it and then offsetting that with a payroll deduction, at the end of the season, they give the employee the option to either continue with the program and transfer the financial responsibility to the employee or to the person, or they simply end the program and sign them back up when the season starts anew. So the program is quite flexible in that regard. There's another question, but we would have to stay on the current plan if they have an open enrollment plan, correct, until the time they allow. Trish, in terms of leaving your current healthcare, it would depend on the current terms there on how best to leave that. I can't. It's not a general answer I can give. It depends on the program and how you've signed up for it. But if you can leave the program, you can certainly enroll in ours at any time during the year. Hope that answers it. If not, Trish, we can certainly get on the phone and talk about it a bit more. Just shoot me an email and we can make that happen. Any other questions? Oh, there we go. Is there member support at any given time? If you mean, so calling us, so you can call us anytime in terms of support. If you need questions about the program or anything of that nature, if you need to change your billing, kind of the typical administrative items that would come to us. If you have questions on your Apex plan and the Apex program, there's a third-party administrator who handles those 365 days a year, 24/7, just like you probably have now with your insurance. On the Sedera side, they also have their own help support folks, and they are also available at any time throughout the year. So with your Apex program, you actually get a card just like you have now with your traditional insurance, and you just call the number on the back of the card if you have any questions. With Sedera, it's just a different number. You don't get a card with Sedera, but you do get a you can reach out to them anytime, and you get a card with Apex. Another question from Anonymous: is the basic plan the only HSA eligible plan? That's correct. The government rules are that you need to have a high deductible plan with other certain limitations, and the basic plan is the only plan that meets that criteria. The advanced plan does not. So the basic plan is the only HSA eligible plan. Also, in setting up an HSA, we don't have a relationship with the bank. There are literally hundreds or thousands of them out there that offer an HSA program. So it's up to the individual to establish their own HSA once they enroll. It's very easy to do if you've not set up an HSA before. It's all done online. It's not a heavy lift at all. So that's it for the questions, unless there are any others. Again, feel free to reach out to us through email or through the phone. We can make sure to get all your questions answered before anyone enrolls. In terms of enrolling, all that information is on the ACRA website. You would actually enroll through their website. All that information is there to enroll. If you are enrolling as a business, however, and you want to set up your business as the party that's financially responsible, you do need to email us. We have to set up an account for you. We turn it around about 24 hours. The information we need is less than a full page of, if you will. So it's really just demographic and billing information, but that is a bit different of a process. So just shoot us an email. But certainly thank you all for your time. We hope you all are well. We hope you continue to stay well, and we hope your businesses get back up and running, or hopefully they weren't delayed at all. But take care, and thanks for your time today, and we'll talk to you soon. Thank you.